assalamu alaikum, good morning, khush aamdeed, ji ayanu, goeiemorgen.
Pagkailangan ni hao, Junashume, Washmale, Ohai, Gonzaimes, Guten Morgen, Hola, Bonjour, Privyet, Kaifahal, Halo Shumachatore, Ahlan Wasal, Marhaba, Buna, Mucho, Gracias, Swabi up, and a very amazing good morning to everybody who's tuned into PTV World and are watching World this morning, alongside the very fantastic Shazad Khan and the very energetic Shiza Hashmi. Hello Shiza, how are you doing today?
I am doing absolutely great. Thank you for asking. What about you?
Well, I
While
think
my
I'm-
energies
well, I
are a
think-
little compromised, I mean, what about yours? You are like super energetic for an early morning.
Well, I don't know, but I think that I feel blessed in a way, and it's because of the fact that every single morning, even at night, when I'm about to sleep, I'm just excited about what I'm going to do tomorrow. And that excitement kind of, when I wake up and I look forward to my breakfast as well. So I don't know, but I think that I was born like that. But then at times there are days when you really have to put in a lot of effort, and it's because of the fact that not everything can be right in your life, ladies and gentlemen, and you really have to live with it. So I only have two things to say today, and that is that these are the two rules which I follow in my life. Number one, if there's something which is in my control, I will put in my 100% effort to get it sorted. But if there is something which I cannot do anything about, I will just stop thinking about it as well and just pray to Allah Almighty that everything comes in shape. Yeah,
And I
that's
think
it.
that is the perfect approach, Shazad, because you have to really have tawakkul, have faith in an entity that created you. He definitely does have a plan for you. Sometimes when things do get out of your
Exactly,
hand,
wow.
then someone is definitely going to take care of that. And like you very rightly said in the beginning, Shazad, there are days. Some days are nicer than others, some are
Yep,
not.
yep.
I really think people who can make it through the hard days, I mean, have patience and have a hope of a brighter future in the coming day.
Yeah.
I think they are the real winners.
Exactly, and yeah, we definitely want everybody to be a winner, ladies and gentlemen, which is why we came up with such statements as well. But we definitely live our lives as per the statement as well, and we try that we can convince or we kind of have an impact on people who are out there as well, and they kind of learn from us. And I think that that's great. Allah has given us a better opportunity every single day, and I think that we really need to utilize it to the best. But other than that, there are days when you do not feel all right.
Yeah.
And, your life cannot always be very normal. Your life cannot always be very glamorous. Your life always cannot be very healthy. And ladies and gentlemen, the kind of weather we have over here in Islamabad these days is just very dicey, and it's because of the fact that one day you wake up, it's 3 degrees, one day you wake up, it's 11 degrees. So, when it's 11 degrees, I do not care to wear my slippers, hence, yeah, flu comes and catches us as well, because flu loves us.
No, exactly, you're right, Shazad. And because of this fluctuating weather, I mean, we're literally just coming out of our very warm and cozy beds and walking out into the cold. So we really don't know where we might catch a flu or fever from, and that is so common among everyone I meet lately as well. Everyone's sneezing, and then you shake hands with them, then you meet with them. You don't know where you're catching anything from.
Exactly.
But I mean, of course, a lot of people are getting sick, so we just felt like, why don't we talk about something that is happening to all of us and how to take care of it?
Exactly, and before we get started with that, ladies and gentlemen, just one simple thing which I wanted to mention, and that is that for all of those people, when they get flu, please make sure that you do not hug anybody, that you do not shake hands with anybody. You can actually tell anybody, whoever is in front of you that I've got flu. If I'm going to shake hands, there's probably a chance that you're going to get that flu too as well. So I think that, and it's just mere discipline. It's just mere being a gentleman or being a fine lady as well. So, there's no problem if you're not going to shake hands. Just let them know that, if I'm going to shake my hand with you, you probably will be sneezing tomorrow as well. So please don't shake hands or hug anybody if you have flu. But other than that, there are several problems which we are about to discuss today, ladies and gentlemen. Majority of those problems are actually related to ear, nose and throat. I think that people who are smokers have a lot of issues with their throat and ears too as well, because if they get sore throat, their ears kind of get blocked as well, and they do not know what to do. Do you have any other problem which you want to discuss?
I mean, just the general flu that every other day we catch, and because it gets so annoying. And this actually reminds me of something, Shazad. I remember before the winter started, you and I sort of promised on the show that we're going to get flu shots this time. I don't know where that promise went, but that is, I mean, faulty at our behalf, and thus we are suffering lately. So, ladies and gentlemen, to speak about ENT, we do have an expert over here with us in the studio.
Exactly, ladies and gentlemen. He is an ENT consultant, and he's none other than Dr. Jamshed bin Saeed. Hello, sir. Assalamu alaikum, and a very good morning.
Assalamu alaikum to you also.
Walaikum assalam.
You have talked a lot about ENT and the things which I had to say.
You're just being
you
generous
just said
over
it.
here.
But as far as changing weather is concerned, and the general, our culture is such that we are not health conscious people.
Exactly.
Right. And we take it so casual because health is the best thing that God has given to you.
Yeah, no
Exactly.
doubt.
And then at times,
So if you are conscious about it and you do not take the things seriously, then you may go into complications.
Exactly.
So as you have said it, that changing weather is one thing where we have to take care of. We must wear our woolies all the time. We must see the temperature and then act and then dress accordingly.
exactly.
And as far as shaking hands and hugging each other, definitely you have to avoid it. But then our culture is such that we are not educated about it.
Yeah.
We do not know how to do about it.
Yeah.
So if you have a viral infection going on, you have to lie down on your bed, take rest, take plenty of fluids. Right.
And let nature take its time.
Because virus is one thing where you do not need antibiotics at all.
Yeah.
Thank you so much for saying that,
Yes,
because the first thing when you tell someone you're going through a flu or something.
As we have over the counter, we get all those lot of antibiotics. And the first thing that we do, get an antibiotic, take it, and after 3 days we just stop it. So we're going into a pre-antibiotic era.
Right.
Exactly. And sir, we definitely want to talk about that, but let's talk about how Pakistanis are with their health. So ladies and gentlemen, over here, in Pakistan, I'm sorry that I have to say this, but people who are actually diabetic, what they do is that they'll actually give themselves an insulin injection and then they'll feel free to eat whatever they feel like, So may it be any sweets, may it be any rice, may it be anything, they will just eat it. I have known people who just came out of the operation theatre, the doctor told them no to smoke, and they are smoking. So, they're just very casual, and then, God forbid, eventually, when it gets worse for them, they're like, Doctor Sahab, please, kuch kar to le, kuch karke hame bas bacha le, bas, Doctor Sahab.
Something bad to happen to us to, sort of take
Exactly. And there's one more thing which I've always confused about, and that is a viral. I mean, I do not exactly know what is a viral. I mean, every time I go to a doctor.
Right. We have three sorts of, there is a virus going on in our atmosphere, there is bacteria, right? And then there is allergens.
Yeah.
Now, these three things attack you. So if your immune system is compromised and you are not properly fit,
Sir.
And how do you to get fit? You have to eat good diet, you have to exercise, you have to make your life in such a way that sleep is very important.
Exactly.
So that builds your immunity. And once that immunity is built up, the viruses and the bacteria are not going to attack you.
Okay, sir, that's great. But, since you just mentioned that, there's bacteria, there's allergens, and, there are 3 different types. Now, as a layman, for somebody who's not a doctor, somebody categorizing all of those 3 things as a viral is not
that is the
justice.
Problem. That is the
it's
problem
not justice,
here.
yeah.
That is
so
the
how
problem.
do we categorize it in the first place?
No, you don't have to. You can't do it.
Okay.
You have to go to a doctor.
Yeah.
Then he is going to diagnose you whether you have a viral infection or you have a bacterial infection.
Right.
But they've never told us that whether we have got a bacterial infection. The only thing they're telling us is that you've got a viral.
That is where our practice comes in. That is what we have studied about. Right?
Go ahead then.
Right. You see, a virus infection, it's one thing where you do not have a high-grade fever.
All right.
There are body aches, right? So, if there are body aches and you are having malaise or you are having a body aches all the time and you are down, right, your resistance is becoming down, that is a viral infection. But in a bacterial infection, the temperature is going to be high grade, right? And there will be specific symptoms about it. So, you go to a doctor and he is going to diagnose. Literally, we have to go for a culture sensitivity test. You get a throat swab, you get a blood culture test. And if the bacteria is there, it will come into that, and then you start an antibiotic.
All right.
In our country, it is very unfortunate that whereas antibiotics are available to you, and the doctors are also so keen to start an antibiotic. You have to wait for 3 days. If you have a fever, you are down, take an analgesic, take an analgesia, take an anti-allergic. Don't start an antibiotic.
I think we're always looking for shortcuts.
Yes, you have to get a blood culture done, you have to get your test done. Once it is established that it's a bacterial infection, then you start an antibiotic.
All right. Thank you so much for explaining that to us. But now we're going to get to some of the common problems that appear among people, near us, related to ENT. Sorry. Okay, to begin with, first of all, we have this culture of sort of suggesting things to others. So, for example, if Shehzad would come to me and be like, I think my ear is hurting, I'd be like, flana tel dal lo garam karke and it's going to be all right. First
That's
of all,
true, but I'm not going to ask her, ladies and gentlemen. That's true too as well.
all right.
Well, we have
Right? We
yes,
do have
yes,
that culture, but
yes.
do we really, I mean, should we do those things?
No, we cannot. We should not. We should not put anything in our ears.
Expert opinion first?
No, for expert opinion first. Because you see, ENT is one entity. Ear, nose and throat are related to each other. The ear always goes bad when you have a problem in your nose and throat. So you have a precondition of nasal obstructions.
Okay.
You have a condition of sore throats, and with the passage of time, if you have not treated it properly, the ears get involved.
Right.
So what happens is, while you are breathing through your nose, some of the air enters the middle ear cavity. Right, through the eustachian tube. Now there is a tube that connects the nasal part with the middle ear cavity. Now that tube functions. It pressurizes the middle ear. It takes the air into the middle ear cavity, and it is with the atmospheric pressure. The higher you go, the air rushes out from the middle ear, and if the tubes is not functioning properly, that means if there is nasal obstructions, your ears are going to get blocked.
Right. And it happens quite often to me too as well, you know, because I have a very low immunity, and it's because of the fact that I have a medical history as well. But other than that, it always happens, and whenever it happens, the doctor has always suggested me an antibiotic. Is that the correct treatment?
Well, the doctor knows what is, he must be right when you have gone to him. So if a doctor prescribes an antibiotic, definitely.
Yeah, I just told you who he is. As well. So, ladies and gentlemen, he happens to be my brother-in-law as well.
Yes,
and they
if a
happen
doctor
to know.
prescribes you an antibiotic, definitely you have to take an antibiotic.
All right. Now coming back to again.
And why for 5 days? And what's the science behind taking antibiotic for 5 days?
All antibiotics have got a half-life. Right? And while we are preparing the drug, this half-life, it goes into our bloodstream, and it has a serum level. So if it is 8 hours or it is 12 hours, that drug has a half-life and it reaches at peak level in your blood at that half-life. So you have to take, and the dosage is also certain to that. So if it is 500 milligram or 1000 milligram or 1 gram, that is where the half-life is, and then it has. So you have to have a peak level in your blood so to kill the bacteria.
All right.
Oh, okay, that does make sense. Now, when we're talking about tonsils, sir, you have to tell me so many things about it. Is it more commonly occurring in children or adults? Does it really have to do anything with age, first of all? How can we identify it? When should we go for a surgery? Everything, please.
Well, tonsils are lymphoid tissue. They are present there. So there is an inner ring of tonsils and there is an outer ring of tonsils, right? So inner ring of tonsils, you have tonsils in the throat, which you know that is called palatine tonsils. Then you have lingual tonsils, and then there are another tonsils in children till their puberty. These are the nasal tonsils, or which you call adenoids. Right. So these tonsils, if they are having recurrent sore throats for at least 2 years, and the interval between an acute attack is less than 3 months, then you go for tonsillectomy. So if the child is less than 16 years of age and he has nasal obstructions and he have recurrent sore throat with this history, and we have certain signs where the jugular digastric lymph nodes are enlarged, so we see that, and then this patient is a candidate for surgery.
All right. But I don't think we're the ones to decide on our own selves, right?
You cannot. You do not have that knowledge with you.
Of course.
You have to go to an ENT consultant to see whether this patient or this child needs an tonsillectomy or not.
All right.
So after 16 years of age, if you have recurrent sore throat, then the throat does not is the primary cause. Then we have to see the nose and the sinuses also.
All right. All right. Now, again, this is going to be a common question, but this is so important for a lot of people watching right now as well. If you are especially mothers and you have, very young babies. Foreign bodies, sir, this is, of course, I mean, babies are curious. You know, children of all ages, they are generally curious, and they tend to put coins and anything weird or attractive that they see in front of them in their mouth, swallow it, or they're even in their ears or something, right? So when that happens, and that does happen a lot, what is the first thing a mom should do instead of panicking?
Well, if you have a foreign body in the throat, So there are two possibilities. Either it has gone to your airway passages, or it has gone to your GIT tract, right, into the esophagus. That is the where you eat. So if it is in the esophagus, there is no dire emergency as such at that moment of time. You have to take the child immediately to the hospital. We'll get an X-rays done, and then we'll do a endoscopy. We'll do an esophagoscopy to remove the coin. But if it is going into a air passage, that is a dire emergency. You have to reach the hospital within 15 to 20 minutes, right? And by the time you are going there, you can hold the child with the legs upside down and try to push him into his chest, into his back side. Try to remove. It may come out like that. If there is a foreign body in the ear, that you should not touch at all.
Really?
Right. You should not touch at all, because you are bound to, if the ear canal is a crooked canal 1 inch long, right? So the foreign body usually goes and gets right beside the tympanic membrane, that is the eardrum. So you are bound to damage the eardrum. You cannot remove the foreign body. I have seen mothers removing the foreign body and getting the eardrum ruptured, right? So you should never touch the foreign body in your ears. You have to go to a doctor.
And ladies and gentlemen, please make sure that you note this as well, and this is from the doctor's mouth as well. Please make sure that you never remove a foreign body from your kid's ear. If it's in the windpipe, God forbid, unfortunately, just hold the baby upside down and try kind of hitting the back as well so that it comes out as well. And if it's in the esophagus, you know, from where we eat as well, you know, all the food goes in. It's not a lot of, I mean, it's not dire emergency, but you still have to go to the hospital, get it checked as well, get the x-rays done. But other than that, sir, not just the foreign bodies. Now, when the babies, when they're very small, so the mothers have this habit of making them lie down and giving them these feeders as well. Because of which the milk seeps into their, you know, these air canals as well. And then a lot of the, I mean, I've gone through it myself as well, because my daughter's now 9 months old, and I've been to the doctor 2 times. And she couldn't sleep, and she didn't let us sleep as well, because it was an ear infection, which we didn't knew about. Because we kept on looking at the baby, everything was fine, and we were like, what's wrong? So when we went to the doctor said, you know, since you feed them a lot of milk while they are lying down, you know, this is something which happens. So what's the best home remedy to do if this is something which is happening at night?
You have to feed the child while sitting up at an angle of 45 degrees. The mother, if mother is feeding the child herself, or it is a bottle-fed child, you have to hold the child at a 45 degrees angle and then feed the child at all times. Right, during the day and during the night. There is a tube that tube that I mentioned, that the eustachian tube, that takes the infection into the middle ear. So if the nose is blocked, right, that is where the infection goes into the middle ear cavity, right? So you have to put saline drops in the nose. Only the saline drops. No other drops should be used in the infant. Nose,
All right. But even among adults, you know, when we're talking about blocked ears or swimmer's ears, it happens, and especially when winter season was starting this time. Me, along with my family, I have no idea what it was, if it was a viral thing or whatnot. We had swimmer's ear for more than a week or something, and we didn't know what to do. And then, of course, eventually we did go see a doctor. Why does that happen? Does that have to do anything with what's going on in the, air around you?
So you, as I mentioned earlier, ear, nose, and throat. The ears are the third thing that gets involved. So there are 2 things that the ear may be blocked. One is the wax in the ear, right? That is produced in the ear. That is called cerumen, C-E-R-M-E-N. That is produced in the. It has got a definite function to perform in the ear, right? So if you try to remove your wax, or if you have wax in your ears and you go for a swimming, that may swell up and you gives you the feeling of being blocked, right? Or the eustachian tube blockage, right? And the infection into the middle ear cavity. When the air is trapped in the middle ear and then it gets absorbed, and then the glands in the middle ear cavity give effusion, give fluids into it. So there is a mixture of air and fluid in the middle ear. That is why you start to feeling heaviness and you start to have pain in that. And the third stage is, if it goes on, it will perforate the eardrum and start to discharge. That is where the ear discharge happens.
Which is why what I'm now going to ask is that, you know, a lot of people in my family are doctors too as well, and they recommend that, you know, we should never use those earbuds as well.
Now we say
why shouldn't we use earbuds?
We say because we are going to push it down.
Because
you're
it's
not
so
going to
satisfying,
remove it.
you know,
Yes.
but when you're doing it, you're like, wow, maza aa raha hai.
Maza aa raha hai. But that is not happening in the external rotary canal actually.
Yeah.
It is happening in the middle ear.
Okay.
90% of the symptoms is because of the middle ear, not at the
right.
external rotary canal.
Okay.
And while you are using these cotton buds, you are actually injuring the external rotary canal.
Ooh.
And the wax which is adhered to the walls of the external rotary canal,
Right.
you are pushing it in.
All right.
Right, and we're not supposed
And
to do
you
that.
may remove about say 10% of the wax with this method, but actually you are pushing it in.
All right.
And one fine morning while you are taking a bath, you say pani trap ho gaya. Right? This is what people commonly
No, you're
come and tell me,
right.
"Ki, sir, was taking a bath. There is water in my
Yeah,
ear."
I
It's
can't
not
take it
water. You
out.
can't have water in your ears. If you do it like this, it will going
You
to come
can't
out.
have water in your ears?
No, you can't.
Oh, okay. That answers a lot of questions, actually.
Yeah, that does answer a lot of questions. But sir, then do you think that we are actually damaging our ears, because there's this
Yes.
theory where people say that the wax is actually good for the ear?
Yeah, of
Yes,
course.
it is good for the ear.
How?
It's produced because it emits a smell to keep the insect out of your ear.
Okay.
It muffles this sudden sound.
Okay.
And it produces an enzymes, right?
Wow.
So everything that is produced in your body is for your immunity, is for your protection.
All right.
And if you are going to fiddle with it, you are going to go into complications.
And sir, there's one more thing which I wanted to ask, and that is that, so whenever you get flu, obviously the first 2-3 days are very hard.
Right.
And at times, at night, it's so hard to sleep because of the fact that you're habitual of breathing from the nose.
Right.
And when you have to breathe from your mouth, it's
Such
very
a
difficult.
struggle.
So, can you give us like an instant remedy with which we can open up our
Take
nose
steam-
at least?
Yes, take steam inhalations.
Steam inhalations.
Yes,
All right.
that is the best remedy.
With a
You
little
can-
bit
for
of
your-
Vicks in it?
Yes, you can put a little bit of Vicks in it, take steam inhalations, and then saline drops.
Saline drops.
Okay.
Normal saline drops
Right.
in your ears, and if it is not getting better, then you go to a doctor.
All right. And sir, one of our producers, it's his birthday today. So we gave him a chance that, okay, if you have a question, we'll ask one question for you because it's your birthday. So Vikas Bangash, happy birthday.
Happy birthday.
It's always good to have you around as well. But the one question, ladies and gentlemen, which Vikas wanted to ask, because Vikas has always been in a fight with his wife, and it's just because of the fact that he has this fat habit of snoring.
He
And
snores.
so
Even when
that's
he's in office.
Yeah, so even when he's in the office. Shiza, that was not, this is not
funny
something we
thing.
should say. But other than that, sir, what is a proper solution for men who actually snore a lot, or women?
Number one, weight reduction.
Weight reduction.
Really?
Yes,
Oh.
weight reduction. Number two, examine your nose.
Okay.
You see, snoring is actually the palatal muscles that are fluttering. So, if the palatal muscles are not tense and your nose is not breathing properly, the forceful air that goes into your flutters the palate muscles,
Yep.
and that is where the snoring happens.
All right.
So, we have a remedy for that. We have surgeries to do this.
Right.
Surgery is fine, but what's the home remedy? I mean, I think a nudge or probably a push to the guy who's actually snoring is the only remedy.
I can't advise him now for that because in Europe and in other countries you have a very bad experience with snoring.
Yeah.
People get divorced with that.
Exactly.
Imagine
Big-
that.
Yeah.
But a lot of people actually, thank you so much for saying that.
So,
because
Vikas, it's your birthday today. Yeah, we do not want it to be,
Yeah, it is
let's
bad.
So
continue.
he can come to me.
Yeah, Vikas, you definitely have to go to Dr. Saab. Balki, in fact, what we're going to do is that we're going to get the equipment over here and we'll get you treated over here.
We're
as
live
well.
here on the show.
Right.
Yeah, exactly. But sir, one more thing, and that has caused a lot of people a lot of problem, and it's a very common problem, and that is that few people can only breathe from one of their nostril, and it's because of the fact that there's this bone which does not let you breathe from both of the nostrils. There's this treatment where people can get it operated, but would you suggest to get it operated, or do you think that it's fine
Well,
if people can live with it?
Right. In a given population, the septum is not ideally placed centrally.
Okay.
Right.
That is the septum which we call you are
Okay.
calling
Yes.
bone. That is actually the cartilaginous septum which is dividing the nose into two equal parts.
Yes.
So, the air entry should be equal in both the nostrils.
Okay, sir.
That is what is normal, right?
Okay.
So, if you have a septum deflection, that means that your air entry at one side is more than the other side,
Yes, sir.
then the functional aspect of the nose is compromised, which is
Alright.
to filter the air that you're breathing in.
Okay.
So once that filtration is not taking place, all sorts of viruses and bacteria are going to enter your respiratory tract.
All right.
Once that enters, then the complications start, and your sinuses are not aerated properly with that.
All right.
So then the secretions comes into the sinuses, and you have sinusitis, all those things. So once you have a nasal obstruction,
yes, sir,
and complete nasal obstruction,
sir,
so that is where your surgery is indicated.
all right.
So before we go for surgery, we get a scan done of the sinuses and the nose, and then proper assessment, and then go for surgery.
All right. Well, that's great. But sir, asking about the surgery, I mean, generally in Pakistan, how much does it cost? Because there are a lot of people suffering from the same condition. I mean, I know that it may vary from one clinic or to another hospital as well. And how long does it take to recover or take all of those bandages off as well? Because you cannot go to work after that
Now
surgery.
we do not use bandages in the nose.
Really?
We are not using bandages now.
On the nose, probably?
In the nose.
Yeah, on?
No, not on the nose.
Okay.
It's just as you go in, you come out.
Really?
No packages, nothing.
So do you go clean your nose as well after the surgery, or?
See, after 4 or 5 days.
4 or 5 days.
4 or 5 days, you will be all right. But then it usually the nose settles down in a month's time.
Okay. Is it painful?
All surgeries are painful.
All surgeries are painful.
That was honest.
But then there, ladies and gentlemen, there are people who love to be under the knife as well. For example, one of those people is Shoaib Akhtar, and I wouldn't mind getting a surgery done as well if it's in my favor. I think there's no problem. There's so many people.
Well, surgery is not an option. You know what?
Yeah, okay.
Surgery is indicated.
Okay.
So there is indication for doing surgeries, and that is curing a patient. We do not take a patient to the theatre while it's not needed there. So you have a data. You have
Sir, but we have a lot of people over here in this country where there are people who are hungry for money, and there are people who actually suggest surgeries when there is no need for a surgery
now
as well.
I'm sorry. Now you are going to go into a discussion.
No, I'm not getting into a discussion, but I'm saying that it's totally dependent on the person or the patient himself or herself to decide whether to get a surgery done or not.
Right.
But I think you were right.
Absolutely.
Surgery is definitely created for curative causes.
Yes.
But we have definitely, taken out different meanings or different reasons to perform that as well.
It's almost 38 years, 38 years for me in ENT, right? And I advise my patients that this profession is a divine profession. Shafa Allah ke haath mein hai na, you know that.
Yeah.
So if you are in this profession, you have to be honest and you have to be very ethical and professional.
Exactly.
Right? So you choose your doctor. And once you choose your doctor, you have to have faith in him.
Exactly.
The faith is one thing which heals you.
Exactly.
That is true as well.
Which is why we, ladies and gentlemen, over here at PT World choose Dr. Jamshed bin Saeed as well to talk about ENT and the problems as well. But thank you very much, sir.
So it's been a pleasure. It's
been a
pleasure. It's been a pleasure. Thank you very much.
Likewise, sir. Likewise. And ladies and gentlemen, for everybody who's out there, if you're going to have a fine throat, only then you can sing very well as well. So the next segment, ladies and gentlemen, is actually going to be what?
Well, it's going to be something really fun, I promise you that. It might as well elevate your mood and shape your day for the best.
Let's
Stay
do this.
tuned to find out. Good morning.
Magla Hills, the heaven of Islamabad. The abode of God, a place where you can explore your soul and meet power of natural elegance of mountains. Spread over an area of 12,605 hectares, the Magla Range, the foothills of Himalayas, are youngest hills with an age of 5,000 years old. Magla Hills are home to around 600 plant species, 250 bird varieties, 38 mammals, and 13 species of reptiles. Magla Range is characterized by many valleys, scenic spots, and beautiful water streams, especially in the monsoon months. Famous for their tranquil environment.
Welcome back to Well This Morning, ladies and gentlemen, on a very energetic morning with Shazad Khan and Shaza Hashmi. And right now, well, before we actually went out on a short break, I promised you something very fun that we're going to do in this segment. And well, I feel like most of you might have guessed by now, this is going to be a musical segment again. We love doing that and bringing the latest talent of Pakistan, the latest quality of music that we're producing to all of you out there.
Exactly, that's great, which is why, ladies and gentlemen, very quickly, without any further ado, because we're only left with 20 minutes and we want to get the maximum out of him. Ladies and gentlemen, we have, he has got a band of his own as well, and he just got back from Shubra. They were performing over there. It was -7 degrees, which
I can't even imagine that.
Which I think is cold. But ladies and gentlemen, these are the upcoming artists of Pakistan.
Absolutely.
And we definitely want to share each and every single moment spent with them, with you as well. So ladies and gentlemen, he's none other than Mr. Sheraz, and he's got a band with the name of Parvaz as well. Hello Sheraz, assalamu alaikum, good morning, how are you?
I'm good, how are you?
Absolutely perfect. It's wonderful to have you. And ladies and gentlemen,
you.
he's not just a singer, he's a radio jockey as well. He's doing radio. Which station are you at?
I'm working on 94.
94. How's your experience so far?
As far as the voice media is concerned, it's difficult.
Yeah.
You're just alone in a studio in front of a mic, and you have no one to motivate you.
Yeah.
You
But
just have to
technically,
speak.
you are actually speaking to
Yeah.
thousands of people. If
But that's technically, no, it's behind, behind the lens, you are alone over there.
Yeah. That's how it is. So, you know, when, since I have done radio myself, ladies and gentlemen, I think that it's only you, yourself, and yourself once again as well, when you are in a radio station. And then at the same time, you know, for all of those callers who are calling in, for all of those messages which come in, I think that's where you get your motivation from. But very quickly, since Sheraz has actually promised our producer that he's going to give us or sing us a birthday song. So, hey, Waqas Bangash, this one's for you again.
Happy
Let's do
birthday.
this. And don't snore, okay? Yeah, let's do this. Day to you. I think I'm not sure, but I think that our viewers actually want to see or look how Waqas Bangash looks as well. So Waqas, if you can share your picture, you know, please go ahead. You know, we need to share it with our viewers as well. Thank you very much, Sheraz, for...
Thank you so much.
Happy birthday, Waqas. Happy birthday.
Happy birthday. What a cute way to say it. You know, okay, so let's do this. There are a lot of people who actually have very different accents when they say happy birthday. I have one friend who says happy birthday. So what about you?
I know people who say happy birthday. Like
Happy birthday, yeah. Birthday.
Not even birthday.
Yeah, and then happy birthday.
Yeah, birth.
There are a lot of things which people used to say. If you are, informal friends with each other,
Yeah.
so there'll be a lot of informal wishes coming to your way.
Yeah.
The way they wish you, sometimes, when on my birthday, I used to get wishes like from radio. It's okay. It's formal wishes. Like,
Yeah.
Happy birthday, Sheraz. You're doing good.
Yeah.
But from my friends, it's another perspective of birthday. You know? Johnny, happy birthday. Happy Hatch Day, bro. How are you doing?
Hatch Day is actually my statement, ladies
Yeah,
and
it's his
gentlemen,
thing.
and for everybody who's actually using this line, at least in Pakistan.
Copyright.
You know, I've been saying
They
it for
should
the
give
last
you the courtesy.
for the last 2 decades as well. But very quickly, coming back to Sheraz, the Mausam is awesome today as well. And since you have a guitar with yourself, please share one of your songs and let's see what do you have with you.
Well, we have been working on some fusion with classical music.
Okay.
Okay.
As the band is, they are completely rock musicians.
Okay.
And they have been fusing my kind of music, like classical music, into rock music. And we have touched, actually, we have dared to touch one of Bade Ghulam Ali Khan Saab's Thumri,
Okay.
Binti Karat Hoon. So I'll start with that.
Let's do this.
देना दे दे देना बेनती करत हूँ पैया पड़त हूँ बेनती करत हूँ पैया पड़त हूँ दिल ना जलाना बलमवा बेनती करत हूँ पैया पड़त हूँ दिल ना जलाना बलमवा दूर ना जाना बलमवा बेनती करत हूँ पैया पड़त हूँ कब आओगे साजन प्यारे कब आओगे साजन प्यारे गिन गिन रहना दिल में ही हारे गिन गिन रहना दिल में ही हारे और ना दुखिया को तरसारे बेनती करत हूँ पैया पड़त हूँ
This was amazing, brilliant, mashallah. This was
Thank
so
you
good.
so much. Thank you.
All right, so is this your genre? Do you have like something specific that you always perform that is like really close to your heart?
Basically, I have been known for performing Qawwali mashup by Sounds of Ali Khan Saab.
Okay.
When I was like 15 years old, I've been doing that particular thing from that time.
Oh.
And every concert we do, we used to keep this song as a showstopper, like the mashup, Qawwali mashup. And people love it. There is this accent of Sounds of Ali Khan Saab, like while he was actually doing sargams, he used to go in falsettos, he used to sing with open throat. So I've tried to copy it a bit, I've tried to do it, but you know, he's a legend, he's a legend. Everyone in the world, I would say, they want to have such kind of vocal, such kind of range and such kind of stability in classical music. So I'm also working on that.
No, but I think it's great to be inspired by such legends, of course. But let's talk about your album that's coming out. When is it due and what should we be expecting?
It's basically a Sufi album.
Yeah.
Okay.
And as the band, they decided to make it a Sufi album.
Yeah.
But after that, we worked on some sad romantic songs as well, because it should, it should go towards those people who do not listen to Sufi music. They should get fascinated by the sound quality and all that. You know, if we are going to be shooting a complete Sufi album, it will be just for the people like me who just just listen to Sufi music.
Right.
So it will be in the market by 14th of February, inshallah.
Inshallah, okay.
So why 14th of February? Because you know the album
The love
actually
theme, you
Yeah,
know,
because-
Sufism, it always admires the love theme.
Sufism is great because you just mentioned that there are a few songs which people with broken hearts are going to love as well. So why on 14th February you're going to release an album where there are songs for people who've actually lost one of their loved ones or who didn't really qualify to be loved as well? I mean, I'm sorry
This is a
to say-
question
I'm
I've been
sorry to
asked
say
by
that,
a lot of people whenever I tell them that it's going to be released on 14th of February. So let me tell you, on 14th of February, there is only one song which is releasing.
Okay.
And that's a Sufi song. I'm not going to be releasing a sad song over there.
Well, that's great. Thank you very much for telling us that as well. And where can people find your music? Where will you release it? You know, do you have a YouTube channel? Any links? Please go ahead.
Yeah, we
Share.
have been working on YouTube channels, but you can find the album on Facebook page. That's facebook.com/PZ the band. You can find the album link over there, and we are trying to consult some channels as well. So we'll be actually kind
That's
of
great.
pushing.
Okay, so I haven't asked my producers and I haven't asked my boss, but this is one thing which we wanted to do. Me and Shiza, we always do it as well. So we're giving you an opportunity that if you want to release the video on PTV World. So we'll give you this option that if you can take out time, and if we have our show on that day, if it's not the weekend, we will play your video. We will on-air it for the very first time, and we are ready to take this privilege.
Thank you so much.
If you're ready,
will be an honor.
please let us know, and that'll be great. And you know, if there's anything which we can help you with, I think that everybody needs to do that, because I was a video jockey earlier with a music channel, so I think I can pretty much do that. And ladies and gentlemen, this is one thing which everybody needs to do. I mean, if there's an area of your expertise and there's somebody else who wants to tap into it, please let them in, help them, and let them know the way and the process to do things as well, which will be great. We'll talk about it after the show, but right now we need to listen to more music as well. So what are you going to share with us now?
I'll try to sing that mashup, because although I'm having a very bad throat right now, you know, singing in
we have a
-7.
consultant ENT over there sitting in the studios with us. We'll get you
You're
checked
here
as
on
well.
the right day.
You know, whenever I used to sing this mashup, people used to say, "Sheraz bhai, aap rula dete hain."
Oh my God!
Let's see.
Let's see.
So it's morning, guys. Don't weep, please.
So at times crying is good as well.
Catharsis is necessary.
शबे गम की सहर नहीं होती, शबे गम की सहर नहीं होती, हो भी तो मेरे घर नहीं होती, जिंदगी तू ही मुख्तसर हो जा, शबे गम मुख्तसर नहीं होती।
वाह, क्या बात है।
मैंने मासूम बहारों में तुम्हें देखा है, मैंने अश्कों की कतारों में तुम्हें देखा है, मेरे महबूब तेरी पर्दानशीनी की कसम, मैंने अश्कों की कतारों में तुझे देखा है, मैंने अश्कों की कतारों में तुझे देखा है, किवे मुखड़े तो नजरां टावा, किवे मुखड़े तो नजरां टावा, नी तेरे जया होर दिसदा, दिल करदा मैं तैनू वेखे जावां, दिल करदा मैं तैनू वेखे जावां, नी तेरे जया होर दिसदा, तू मेरा मैं तेरी होई, तेरे जया मैनू दिसदा नी कोई, तू मेरा मैं तेरी होई, तेरे जया मैनू दिसदा नी कोई, तू जया वे तैनू सीने नाल लावां, तेरी रावां विच रख दे सावां, नी तेरे जया होर दिसदा, मेरे माया नी तेरे जया होर दिसदा। Nene zaza nene zaza nene zaza re sa ne za, wa ga ma re sa da ni re sa sa sa, गम है या खुशी है तू, मेरी जिंदगी है तू, मेरी जिंदगी है तू। दोस्तों के दरमियाँ, दोस्तों के दरमियाँ वजह दोस्ती है तू, मेरी जिंदगी है तू। उदासियाँ जो न लाते तोर क्या करते, रश्म शोला न जलाते तोर क्या करते।